Hello. Today, I would like to tell you about a very important study that was just presented at the plenary session for the International Myeloma Society. The study is called AURIGA, and AURIGA is a randomized phase 3 study that compared the use of daratumumab plus lenalidomide versus lenalidomide as maintenance. Now, there's a couple of important caveats. Patients were eligible for this trial if they had achieved at least a VGPR, but they had to be MRD positive. So, in other words, strictly speaking, this is not for MRD negative patients. Second of all, patients had to be naive. That is, they had to have no prior treatment with CD38 antibodies like daratumumab or isatuximab. So this would be the classic patient coming to a transplant center, say being treated with VRD. The study primary endpoint was conversion of those patients that are positive to negative in their MRD. And not surprisingly, the study was positive. The conversion rate was as high as approximately 60%. That is, you were 60% positive and then converted to negative, which is really a wonderful result. We've learned from this and other clinical trials that an important goal is to try to reach that negativity. Now, for patients, I think it's important to know that we can't always do that. But if we have a way, or if you have something that you can do that would make it more likely to become negative, in general, I would say that's a good thing. Now, it's a better thing when we have treatments such as daratumumab, which is a very well-tolerated monoclonal antibody, and it doesn't have any major toxicities. We take it carefully, but it's very well-tolerated. So I think the study really separates the question. If you have a patient who completes transplant, they're MRD positive, give them daratumumab as part of their maintenance approach. And you'll hear that doctors talk about consolidation versus maintenance. It's just semantics. It's more of effective treatment. So I'm very excited to see those results. They build on what we knew from other clinical trials, which you may have seen in other videos like Cassiopeia or Perseus. But it really tells us that what I say is a hashtag, you have to finish the job. Thank you.